Indication: ADAKVEO, crizanlizumab-tmca, is a selectin blocker indicated to reduce the frequency of vaso-occlusive crises, VOCs, in adults and pediatric patients aged 16 years and older with sickle cell disease. Highlights of important safety information. In the sustained clinical trial, infusion-related reactions occurring within 24 hours of infusion were observed in 3% patients treated with ADAKVEO 5 mg per kilogram. Monitor patients for signs and symptoms. Discontinue ADAKVEO infusion for severe reactions and manage medically. Lab interference with automated platelet counts, platelet clumping, has been observed following administration of ADAKVEO when blood samples were collected in tubes containing ethylene diamine tetraacetic acid, EDTA. Run tests as soon as possible or use citrate tubes. The most common adverse reactions, greater than or equal to 10%, were nausea, arthralgia, back pain, and pyrexia. Please see additional important safety information at the end of video and full prescribing information available at adakveo-hcp.com. ADAKVEO is the first and only FDA-approved selectin blocker that inhibits key cellular interactions in sickle cell disease. To better understand the mechanism of action of ADAKVEO, let's review a key component of the pathophysiology of vaso-occlusion in sickle cell disease. Sickle cell disease is a complex genetic blood disorder that involves more than sickled red blood cells. Sickle cell disease is associated with a pro-inflammatory state within blood vessels. This environment can promote the recruitment of white and red blood cells as well as platelets. As these cells interact via adhesion mediators, multicellular clusters are formed in the bloodstream. These events can result in vaso-occlusion. Vaso-occlusion within the blood vessel can reduce or block the blood flow to organs. Let's take a closer look at how P-selectin, an adhesion mediator, plays a key role in multicellular interactions that can lead to vaso-occlusion in sickle cell disease. P-selectin is overexpressed on the surface of activated endothelial cells and platelets. P-selectin binds to its ligands, including P-selectin glycoprotein ligand 1, or PSGL1. These ligands are found on white and red blood cells, as well as endothelial cells. Binding of P-selectin to its ligands can promote a key interaction, leading to multicellular clusters in the bloodstream. ADAKVEO is a humanized immunoglobulin G2 kappa monoclonal antibody that binds to P-selectin on the surface of activated endothelial cells and platelets. By binding to P-selectin, ADAKVEO blocks interactions among endothelial cells, platelets, white and red blood cells. The mechanism of action of ADAKVEO is based on in vivo and in vitro studies. Preclinical activity does not necessarily correlate with clinical outcomes. ADAKVEO is the first and only FDA-approved selectin blocker that inhibits key cellular interactions in sickle cell disease. ADAKVEO, or crizanlizumab-tmca, is a selectin blocker indicated to reduce the frequency of vaso-occlusive crises in adults and pediatric patients aged 16 years and older with sickle cell disease. Indication: ADAKVEO, crizanlizumab-tmca, is indicated to reduce the frequency of vaso-occlusive crises, VOCs, in adults and pediatric patients aged 16 years and older with sickle cell disease. Important safety information: infusion-related reactions. In the sustained clinical trial, infusion-related reactions, defined as occurring within 24 hours of infusion, were observed in 3% patients treated with ADAKVEO 5 mg per kilogram. Monitor patients for signs and symptoms of infusion-related reactions, which may include fever, chills, nausea, vomiting, fatigue, dizziness, pruritus, urticaria, sweating, or shortness of breath or wheezing. Discontinue ADAKVEO infusion for severe reactions and institute appropriate medical care. Laboratory test interference. Platelet counts. Interference with automated platelet counts, platelet clumping, has been observed following administration of ADAKVEO. In particular, when blood samples were collected in tubes containing EDTA. Run blood samples within 4 hours of blood collection, or collect blood samples in tubes containing citrate. When needed, estimate platelet count via peripheral blood smear. Pregnancy. Based on animal data, ADAKVEO has the potential to cause fetal harm when administered to a pregnant woman. Advise pregnant women of the potential risk to a fetus. ADAKVEO should only be used during pregnancy if the expected benefit to the patient justifies the potential risk to the fetus. Most common adverse reactions. The most frequently reported adverse reactions, greater than or equal to 10%, in patients treated with ADAKVEO were nausea, 18%, arthralgia, 18%, back pain, 15%, and pyrexia, 11%. Other clinically important adverse reactions. Clinically relevant adverse reactions, all grades, that were reported in less than 10% of patients treated with ADAKVEO included oropharyngeal pain, abdominal pain, upper abdominal pain, lower abdominal pain, abdominal discomfort, and abdominal tenderness, diarrhea, vomiting, pruritus and vulvovaginal pruritus, musculoskeletal chest pain, myalgia, infusion site reaction, infusion site extravasation, infusion site pain, and infusion site swelling, and infusion-related reaction. Please see full prescribing information available at adakveo-hcp.com.